The Hamad Medical Blood Donor Center is a health organization responsible for provision of blood supplies for the whole state of Qatar, including all governmental and private health institutes. They rely on local blood resources of blood supplies donated by voluntary, non-enumerated blood donors. This organization has successfully managed to attract thousands of donors each year. Their role is to provide life-saving blood products and services in transfusion for patients in Qatar, and to safeguard the nation's systems of life essentials in blood and plasma. When arriving, you need to present a suitable identification document, such as your Qatari ID, health card, driver's license or passport, and the receptionist will then register you in the system. While waiting, the donor should read a brochure because it would provide them with sufficient information about potential risk factors, the rules and conditions of donating blood. Donor also should read information about blood donation educational material as well as general information. After registering the donor data, the donor goes to take vital sign measures, where first the nurse checks the donor data and asks some questions related to the donor's health, lifestyle, and whether the donor has previously donated blood. Then, the nurse begins taking vital measurements such as blood pressure, body temperature, and pulse level. Vital signs should be normal, with a blood pressure of less than 120 per 80 millimeters mercury, a body temperature between 36.5 to 37.7 degrees Celsius, and a pulse level equivalent to 60 to 100 beats per minute. This is followed by checking the iron level in the donor's blood and knowing whether the donor's blood is suitable for donation. And this is done by taking a blood sample from the finger and then placing it in a special machine that detects the hemoglobin level in the blood.
We will now illustrate how the blood will be drawn from the donor. We will introduce you to the processes and the steps. Now, with regards to how to draw blood from the donor, the first step is to wash your hands and to wear gloves. You can then start to prepare the equipment. The first step is to apply a tourniquet to help you feel the donor's veins. When looking for a vein, it is better to have one that you can feel rather than see. After that, the site should be disinfected using bovine iodine. It should be cleaned in a circular motion for about 30 seconds. Then, take the sheath off the needle, make sure the bevel is pointing upwards, secure the vein, and then insert the needle at 20 to 40 degrees in the direction of the vein. Then the draw is performed and the blood is collected in the tubes following a specific order of blue, yellow, then lavender. The tubes contain an anticoagulant which prevents the blood from clotting. The tubes need to be mixed thoroughly to ensure no blood clots form, and then the blood can be tested and screened. In addition, the blood is also collected in blood bags that are used for donation. This bag is placed on a shaker to prevent the blood from clotting. Before taking the needle out, remove the tourniquet. Get some cotton and cover the site of the needle injection. Then remove the needle carefully. Apply some pressure on once the needle is out for 1 minute. At the end, the blood bag is labeled with the donor's information, and then it will be sent to the second floor where the blood test and screening will take place. The next part is automation. The second floor of the Blood Donor Center consists of two parts: the donor market testing unit and the component processing. With respect to the donor market testing unit, there needs to be a careful donor selection because it plays a major role in determining whether a unit of donor blood will be therapeutically effective and free of transmissible diseases. There are two parts in the selection of eligible blood donors. The first is to ensure that the donation of blood or blood components will not compromise the health of the potential donor. The second is to make sure that a potential donor's blood will not transmit a disease state to the potential recipient. The center contains modern and high-quality international medical devices which provide users with high accuracy in the clinical results. The first one is called DSZ-Denex. It is used to detect 4 species of malaria. The first one is Plasmodium falciparum. The second one is Plasmodium malaria. The third one is Plasmodium vivax. And the fourth one is Plasmodium ovale. This is done by Nuvaliza Malaria Kit. After the reagent and the samples are placed into the machine will run and conduct the tests. It will then express the results in the computer program. The second medical device is called Architect. It consists of 3 types: Integrated Architect, Clinical Chemistry, and Immunoassay. It is used to detect different types of viral hepatitis in patient samples such as hepatitis B surface antigen, hepatitis B core antibody, hepatitis C virus, hepatitis B surface antibody, syphilis antibody, human T-cell lymphotropic virus antibody, and HIV antigen antibody. The third medical device is Autolia. Its method is like the Western blot. We put the strip that contains antigen of HIV, hepatitis C virus, human T-cell lymphotropic virus, and syphilis into the train. Then we put the reagent as well as our patient serum that may contain HIV antibodies, hepatitis C virus antibodies, human T-cell lymphotropic virus antibodies, and syphilis antibodies. All of them have a confirmatory test. The last medical device is Proclake's Panther system. This system is used to detect the nucleic acids of 3 types of viruses: HIV, hepatitis C virus, and hepatitis B virus. For example, it can detect the RNA of HIV plus hepatitis C virus, and it can detect the DNA of hepatitis B virus. With regards to component processing, the donor's whole blood unit should be scanned and mixed before the centrifugation process happens. Then the automated whole blood processing system is used to separate the whole blood into 4 main components: red blood cells, plasma, platelets, and a buffy coat. However, the buffy coat is filtered and removed after centrifugation. The remaining components should be stored in specific temperatures. Red blood cells are stored in a controlled temperature of 2 to 6 degrees Celsius. Platelets are stored at a temperature of 20 to 24 degrees Celsius. And plasma should be stored at a temperature of at least -18 degrees Celsius for 1 year or -65 degrees Celsius for 7 years. To sum up why we should donate blood and why it is so important, it is because blood is the most precious gift that anyone can give to another person. It is the gift of life. There is no substitute for blood. Every 3 seconds, someone needs a blood transfusion. Your donation will help us save up to 3 people. You don't have to be a doctor to save lives. Just donate blood.